Good afternoon, everyone. I'm Laura Lee Dauber, and I'm part of the marketing team here at Amatech, and I will be your host for today. But there are much more qualified people to guide us through this webinar than me, so I'll introduce them. But before we begin, there's a few housekeeping not rules, but housekeeping things that need to be done. We are recording this video, and so you will receive a link after we're finished the webinar. And please feel free to ask any questions using the Q&A button at the top of your screen or at the bottom, depending on how you have it set up. And our panelists will answer them during our Q&A session towards the end of this session. So welcome again, and thank you for joining us to discuss the pitfalls and possibilities of automating clinical workflows. As I know you are all aware that there are challenges in balancing patient care and the ever-increasing demands of administrative tasks. I know that paperwork is not part of a career choice for anybody, but in this case, it is a necessity for patient well-being, and that goes especially in the case of our guests' case that we're discussing today. Automating these tasks does seem like an ideal solution, but often when it comes to the clinical setting, automating these processes tends to go wrong. I'm sure many of you have probably faced roadblocks or failed automation attempts yourself and may not even know what went wrong. So in today's webinar, we're going to be exploring our guest automation journey of a state-mandated reporting workflow. The state of New Jersey requires healthcare providers to complete a perinatal risk assessment form containing 350 data points for each trimester of every pregnant patient in their care. For our guest, that meant 2,400 nursing hours were spent researching, collating, and entering data for this one task every year. By the end of this webinar, their story will have provided you with a clear roadmap for transforming your own clinical workflows, highlight some of the common roadblocks to avoid, and get you on your path towards returning your clinical staff's time to your patients. So let's get started by introducing our discussants. With us today from St. Peter's University Hospital, we have practice administrator Michelle Goodman. Now, we were also hoping to have her colleague Kai Rita with us. Unfortunately, Kai can't be with us today, but she was an integral part of this automation process, so we want to make sure that she's recognized. Joining them from Amatech is our Customer Engagement Director, Meg Melberg, and our SVP of Operations, Katie Oliva. Before I hand it over to Katie to get us started, I will be posting a poll in the chat today asking you all just how much time you spend on duplicative administrative work. So please, throughout the webinar, feel free to check out the poll, give us your answer, and we'll look at the results during the Q&A session at the end. All right, Katie, I'm going to hand it over to you now.
Thank you, Laura Lee. Michelle, we've worked together quite some time, and so I thought we'd start with me just asking you a couple questions as it relates to the PRA process. So before we jumped into automation, what did the manual PRA process look like, and what is the PRA?
So thank you for having me, first of all. So the PRA, which is the Perinatal Risk Assessment Tool, it was created by the state of New Jersey for uninsured and Medicaid patients. It looks to collect clinical and psychosocial risk factors that affect pregnant women. So their goal is to improve maternal and fetal outcomes.
And just talk a little bit more, because we've talked about this, what that means in terms of what they do for patients from the PRA risk assessment.
Yeah, so they collect a lot of information. They share it with the insurances in order to help provide services, referrals for things like breastfeeding support, childcare assistance, substance use, things like that, domestic violence intervention. So they really provide a lot of wonderful services.
Yeah, it's a great resource for patients in your state for sure. And it sounds like it just does a lot of good.
Yeah, absolutely.
So when your staff would complete the PRA process, what did that look like? What was the negative impact of that process?
So it was a very time-consuming process. It consists of three separate forms: the first visit, the follow-ups, and the third visit. The third trimester form. And the staff would have to collect all that information and fill it out on the paper forms, which they were at least 3 pages long. So each form took probably anywhere from 5 to 20 minutes, and a total of about 60 minutes per pregnancy.
Wow.
So
And
really, yeah.
and while you knew it was a great reason for doing this, everyone hates doing duplicative work. So taking that
Absolutely.
information from the chart, from the patient, and then putting it into another website.
Exactly.
And then
a
from
lot of
paper back to the website too. So you're doing
Right.
it in a multitude of ways.
Absolutely. Extremely tedious.
And so right when we started working with St. Peter's, the PRA process was brought up like almost right away as something that your organization wanted to explore, to automate. When we first started meeting with you, we kind of talked about this process has been looked at before, and there's been attempts to try to mitigate some of that rework and that duplicative work. Can you kind of just talk up through those and what efforts were made prior to us starting to work with you?
Sure. So initially, the clinical staff would fill out all the forms. So like I said, it took about 60 minutes per patient, if you're uninterrupted, to fill out those forms. And at one point, we reduced that and we had them just fill out the initial form. But then the administrative staff would have to almost be detectives and go into the chart and look through the chart to find that information and then submit it onto the state's website.
And Family Health Initiatives, who owns the whole PRA process, had been trying to work with organizations like you guys, Michelle, to attempt to find ways to make it a little bit more cohesive, correct, in the past. Can you just talk through that a little bit? Yeah.
Sure. So they did attempt an interface, and they asked us to be a part of it since we do see so many patients. And, we tried it and it just did not work. It didn't collect even 10% of the data that needs to go to the PRA website.
And a lot of that came back to where a lot of our work in the beginning, which we'll get to in a little bit, about that location and organization of the information in the chart, right? Is that the interface was almost making you only look in one section where this information is in a multitude of different ways, different views, and different areas.
Absolutely. That was one big issue is, like you said, people were documenting in different places. We have 3 separate departments: women's health, high risk OB, and the birth center. And, people would be documenting in different places. So like I said, the administrative staff for us in the women's health center would have to play detective and search through the chart and through the visits to gather up all that crucial information on the patient.
Yeah. And things can be labeled different ways too. Medical terminology, there's not necessarily just one way we say things. We might say drugs, we might say medications, we might say.
Absolutely. Yeah, you're right. And then a lot of times the administrative staff, they were unsure. So they would have to go to the provider and the nurse and spend additional time to ask them, what does this mean? Or where do I find this information? So extremely time consuming.
And what's in the PRA even doesn't translate to how you're defining it in the EMR. So even just the different medical terminologies, but then you add that the PRA is speaking to something that might be completely different than how you have it worded or laid out in your EMR as well.
Exactly.
And we kind of learned through this journey and started to kick off with St. Peter's that Family Health Initiatives has been very invested in trying to find ways to help make this process more efficient, and other organizations had tried to either leverage that interface or look to automate this process, and it has failed before this. So I know we'll talk about a little bit more, but St. Peter's was really the first to take on this task of truly automating the process, which is really cool.
Yeah. Yes, exactly. So for, at least 4 or 5 years that I can think of, I was, just bringing this back to my executive director, Michelle Giuliano, and just saying how time consuming and tedious this work is. And, we had to do it, of course, for every patient, every OB patient. And we see, so many patients, we have up to 1,800 deliveries per year. So you could just imagine how much work that was. And she heard it, she went back to Dr. Tannenbaum, our Chief Information Medical Officer, and with their support, we were able to start the project. So we're extremely grateful.
Okay, I think that kind of is a really good segue. Before we start to talk about like how it worked and how we got this automation live, we do have a video to share that kind of exudes the entire process and some of the outcomes that happened.
Our client's OB/GYN nursing staff was burdened with manually submitting state-required prenatal risk assessment, or PRA, forms for 1,600 patients each year. This labor-intensive process consumed approximately 2,400 clinical hours annually. But now, thanks to Amatech Solutions, this process has been completely transformed through intelligent automation. Each day, the bot scans the schedule for new appointment types that require the submission of the PRA form. After the appointment, the bot retrieves all necessary data from the patient's EMR. If any required information is missing, the bot pauses the process and sends an email notification to the assigned personnel, ensuring all data is accurately entered into the EMR management system. The following day, the bot rescans the EMR for updated information and proceeds to complete the form on the state's form submission website. At the PRA form website, the bot checks if the patient already exists in the system. If not, it initiates a new file. Otherwise, it updates the existing one. The bot fills out each of the 350 fields across 7 sections, including patient information, medical information, pregnancy risk factors, patient's medical conditions, psychological risk factors, and the critical 4Ps Plus and referral sections to ensure the patient receives any required additional medical support to facilitate a safe and successful pregnancy. Once all the fields are completed, the bot submits the form and sends an email confirming all PRA submissions for the day to the designated staff. The journey to this seamless integration was guided step by step by Amatech's healthcare experts, ensuring that the workflows and processes were aligned and optimized for automation success.
Okay, so I think that was a little choppy for everyone, but I think you get the gist of what we're trying to cover, and that is there are a lot of fields that were completed or are completed through the PRA process. And if there's information that's missing, an exception is sent to the leaders and the clinical staff to be able to follow up and fix any of the errors in the documentation. And then from there, the bot then the following day will rerun the PRA and complete it. So that's the synopsis if you didn't get all of that information from the video. Okay, Michelle, let's talk about how it worked. So when we talk about the PRA process, what did we have to do or what steps were required prior to just jumping into automation?
So we had to meet, a lot of conversations, a lot of meetings. Our initial meeting, I think, was about 2+ hours long. And in that time frame, we had one of the staff just kind of show us what they do for each form. So that one meeting was 2+ hours long, and I don't even know if we finished the first visit form within that time. So a lot of back and forth between the EMR and the PRA website, and just the EMR looking through the chart, trying to find the information that was necessary. Yeah, so you can see how painful it was, basically.
I think that was eye-opening for us all. I think it was Kai who was going through the demonstration with us, and she would say, well, it could be here, or it could be here, or we could find it here. And we're trying to take notes going, oh my goodness.
And if it's not there, we call.
Yeah, I think it was Kai and Charo from High Risk OB. And it was just a lot of bouncing back and forth. Everyone was very overwhelmed after that meeting.
Yes. And we definitely became BFFs through that. We had a lot of meetings, you're right.
Absolutely, absolutely. I think initially on the team it was you, Katie, Meg, Amir, Daisy,
Yeah,
right,
yeah,
and Nico, and
yeah,
Kyra, and myself, and Wendy Kang, our project
yep.
coordinator. Yes.
Yeah, a lot of time together for sure. We
Mm-hmm.
learned a lot about each other. In addition to that, we talked about the medical terminology and the different names that we could use for labs or for different diagnoses that we might have to find. We also found a lot of automations that occurred through the PRA process, I would say. Some of the automatic referrals that occur if certain things are selected. And so it
Yes.
was helpful for us all just to talk through, how we wanted that to be handled and when that automatic referral should or should not happen for what types of patients.
Absolutely.
And,
Absolutely.
and we learned like very early on through those long meetings, trying to figure out how to kind of standardize and process improve the current workflow, right? A shout out to Wendy being kind of your EMR expert on the team, really helping us very quickly start to figure out how to like leverage your EMR, right? And where can we build and customize and standardize within your EMR? So not only just for the automation to work, but just to standardize the workflow and the location of the charting and documentation as is.
Yeah, absolutely. As an organization, that was very important to us to standardize it, especially between the different departments of OB. So we worked a lot with AMATAC, and then as well as just the St. Peter's team, Wendy, Kai, myself. Hundreds and hundreds of hours. Just trying to make it all work and make sure it's consistent.
And we were all very much on the same page. Like we didn't want to automate a bad process, right? Like we wanted it to make
Absolutely.
sense. The automation needs to work, but it needs to make sense for you and the staff too.
Yes.
And I think we all kind of came in, and especially in those beginning phases, very much like focused in on that.
Absolutely.
Yeah, and I think the other piece that was important for all of us is not just to get the PRA information correct, but for you all to be able to find the information to provide clinical care. And I think through that standardization, that allowed that to happen as well.
Definitely. Yeah, we built, I think, over 300 fields in our EMR, right? Yeah, a lot. But at least, the staff, it's consistent. Whether you're in women's health, high risk, or birth center, the staff is putting the information in the same spot. So they know always where to find it. And so does the admin staff, if they needed to look for it. So that was huge.
Yeah. So to that point, once the groundwork was completed in terms of identifying where things were in the terminology and getting the documentation, what did it take to get automation implemented? You talked a little bit about, the staff and educating them. Can you talk a little bit more?
So Kai and myself, we created education slides as well as a training video. And it's just being out there with the staff. So once we went live, we needed to make sure that we were supporting the staff, not just sending a video or slides, but being out there when they're in the visits. If they have questions, they're not sure where to document, just knowing that they could just ask us a question really quick and we can kind of show them and guide them and support them until they get it and they understand.
Yeah. Was there anything else that was required to be completed before we were able to implement the automation? I'm thinking things like the sandbox that was created. So family health initiatives allowed us to have a
the
sandbox.
training. The train environment. Absolutely. That was huge. So thank you to Colleen Pope for all of her support at Family Health Initiatives. But yeah, her team created that training, that train, how do you call it? Just,
testing
just
environment.
the environment.
Yep.
Thank you.
Yep.
Thank you, Meg. The test environment, so that we can do that, check, make sure everything works before we went actually live.
Yeah.
So that was huge.
Allowed us to have test patients in Athena as well, which
Yes.
was really helpful. So we could practice with not hurting any information or any data initially to make sure that we were getting the process all straightened out from the get-go.
Absolutely. And that's crucial before you go live with anything. Absolutely.
We did a lot of like outside of the box thinking too, just like trying to use your reports from your EMR. And like, again, you guys did a lot of work on the St. Peter side, and kudos to your IT team too, to even build out some other portions of your EMR as well before going live, which, affected the training and made that even more significant for the training, but in overall made your workflow a lot more efficient.
Exactly. And I think, at first the staff was a little overwhelmed by the addition of, all the fields that they had to complete. But once they started doing it and getting used to it, it was so much easier than having to fill out these paper forms and search for information. So it was a big help.
Were there any complications along the way, and how are those complications managed?
Complications, you mean for the staff or
just
in
bumps along
general?
the way that we had?
I think, you can prepare as much as you want, but when you actually go live, sometimes, things aren't, you can't expect everything. So, just kind of going back and adjusting logic if you need to. With the reports, there's opportunities for re-education with the staff, things that they missed, which is huge for us, just making sure that we're getting everything, all the crucial elements that need to be in the chart. So that was really great. And then just, you re-educate, and after a while they get it, they understand. So that was really big.
Yeah, I think I remember after day 2, Kai reaching out and saying, I would just like to quit doing this. I think we should just,
just go the manual, right? Just go back to the manual, please. Yes, you're right. So, at first, we had to check our EMR, making sure we didn't miss anything. We were checking the PRA website to make sure the bot wasn't missing anything. So a lot of back and forth, at first to make sure it was all working. So yeah, it was definitely overwhelming at first when we went live.
You guys, definitely patience is one of the virtues to have in any automation process,
yes.
but especially one as complex as this was. Absolutely. And I think after the second day, and then the second week, and then the second month, it definitely got easier and easier along the way.
Yeah, and having your support, I'm sorry, Vig, having your support, Katie, and you auditing the charts was huge for us, huge. That really played a big part. So we were able to catch a lot of things in the beginning when we went live.
Yeah, I feel like I could document in your record now. I feel like I'm part of the team.
An honorary St. Peter's employee.
Oh, that's right. And I think Nico, our developer, probably feels the same way. He probably learned more about clinical items than he ever wanted to know through this process.
Absolutely. Nico's been very supportive, very receptive if we need to change something. There's a lot of changes that happen unplanned, whether it's on the PRA side or our EMR side, and Nico's been very receptive to everything. He's been wonderful to work with.
Yeah. Another shout out that I'll provide to you mentioned Colleen and Family Health Initiatives, and they have been wonderful to work with as well. And being able to email them and ask them about different things that were occurring on the PRA side was extremely helpful. And they were so collaborative along the way and still are.
Yes, absolutely. And even, initially, once we went live, they would send changes, a week later or a month later. And we said, well, it takes time to implement these changes. And as soon as I told Colleen that, she was so receptive. Okay, we're going to, slow it down. We're going to give you a month's notice. And they were so willing and so excited for this project because we were the first hospital in New Jersey, to successfully do this, that she really was, they were all very excited to see us succeed.
And that was a little bit of a fear in the beginning, right? I think there's that stigma that when you're working with any government agency or state agency, that there is a little bit of fear about automation and technology being implemented into some of these workflows. And they completely put that to rest. They were so interested in what we were doing and really wanted it to be successful, and also have been working with our team, Amatech team, and, Michelle, your guys' team. How did you do this, and how can we have other organizations learn from this and implement this into their operations too, which is super cool that they know that this is important and gets patients what they need, but wants to make it as easy as possible for your clinical staff too. So it was just like a breath of fresh air to work with
it really
an agency that really wanted to see that happen.
Yeah, I agree completely.
I do have to call out too, I kind of just overarchingly why I think it was so successful to so we just had a really good mix of team members too, that we worked with, obviously Michelle, Kai, you guys know your operations in and out, Katie being a nurse, me having healthcare operations, but then we had Wendy, who was your EMR project, management phase, who when we were going through some of those bumps in the go live, being you should have seen other go lives, and you would have seen what bumps really were like. So then having the Nico and Daisy with the development expertise. So we were hitting all angles at all times.
Yeah, we worked really, really well together as a team, and you guys were so patient with us, which was wonderful. Really, really easy to work with. So we're grateful for that because we wouldn't have been able to successfully do this without that. So,
And I think, Michelle, I know you mentioned it before, like when you guys started with us digging into this, no one anticipated it being this huge of an automation and this huge of a project. So
yes,
everyone really was willing to, dive in and do what needed to be done.
I agree. I think we started this in September of last year. So we're approaching a year,
Mhm.
which is amazing.
Yeah.
It's a long time, but it was worth it.
Well, and I think that all the work that has been done since Go Live, that patience and us continuing to meet like we did, and for Katie and Nico to be doing the auditing, just so there it wasn't okay, we went live hands free, no one's worrying about it
Yeah.
anymore. But in recognizing this is a living, breathing thing that we need to kind of always have eyes on. But at the same time, you really are starting to see the rewards of it in your operations now.
Yes, absolutely.
So we talked about how we started up, the pre-work, the automation. How do we work together now? How do we continue to work together?
So generally we meet once a month. We have Nico who we're in contact with. The bot sends the reports. Nico's kind of managing everything from behind the scenes. And if anything comes up, we reach out to Nico. But we also have our standing meetings once a month. So if something comes up in between, I'll shoot you guys an email and right away, we'll jump on a meeting and have a discussion if we need to. And that's really important.
And just keeping account of changes that might happen like on your EMR side and maybe operations, but also changes that happen on the PRA side, right? So that we can all be lockstep and make sure that not only is it working for the automation, but it's still working for your workflow too.
Absolutely. We received a change recently on referrals that we had to just jump in and, all of a sudden we're making this change and, just meet and kind of figure it all out and, when it's going to be live. So yeah, it's a constant, not as much as in the beginning, of course, but you need that support going forward.
Right. Exactly.
Yeah.
Katie, any other things on your end?
No.
Well, I think that I know that like we said, the video is a little bumpy, but you were able to see some of the numbers on there of the workflow. Michelle was, great about talking about how we went from that manual process to, and then just to be clear, because of the work and the time commitment and the out of box thinking of the team, we went from when we started meeting with you guys, we were thinking maybe we could automate 70. I think we said 70% of it originally, Katie. And essentially now it is 100% automated. Between the EMR, the automation, and our leveraging of the PRA website, Michelle and Kai and the nursing team have to be very much in lockstep with what they need to put in their EMR, but they can trust that the bot is doing what it needs to do in the PRA, which is super cool. So again, being able to start where we started and see that we exceeded expectations of where we needed to go is always a good place to end a project.
Absolutely. And just, for us, we just do our spot checks as we would normally. So, once a month, maybe we'll spot check, some charts just to make sure everything's accurate on our end as well.
Unfortunately, we'll never get rid of auditing in any sort of clinical setting. It never will go completely away. But Michelle, I feel like I not only have you guys gotten such a successful implementation because of all the work that you've done here, but you were the first team in St. Peter's to also automate a workflow at all. So like, how does that feel for you guys as a team? And also, how do you think it opens up St. Peter's to, continuing to build off this?
It's amazing. We were a little nervous in the beginning. Is it going to work? And, can we, put our trust in Amatech? And, and as we moved along, we saw, this is really working. It's moving. And then we went live and, we had, of course, hiccups, that's to be expected. But just to see it be successful and actually functioning, it's really just, it feels wonderful. It's very exciting. And I'm sure it's going to open more doors for St. Peter's, as well as other healthcare systems, So it's great. I think, with the staff, I think, change is always hard, of course. So they were a little hesitant in the beginning to, to have to do this extra work. And we have, about an hour for our new OVs. And they said, there's no way we're going to be able to do this. And, we're going to need more time in the visit. And we said, no, you're going to be fine. We're out there with you. We're going to support you in the beginning until you get used to it. And they're doing it, which is fabulous, so that gives them more confidence that they can trust in the automation process, which is great.
When you, your leadership team learned so much about automation too. Like, think about how daunting it seemed in the beginning to now, even towards the end, we're talking with members of your St. Peter's team. And you're like, you know what, this would be a really cool thing to look at to automate. And this would be, so just starting to understand what that can look like in other workflows is, awesome to see. And your nursing staff and everyone, as they continue to build that buy-in, are probably going to come to you with suggestions too.
Exactly. That's okay. We were happy to be the guinea pig, I guess. You can call us, right? Where that was okay. It was very exciting to be a part of. So I'm very grateful for that.
Well, and for you guys to be your first automation is such a feat, considering, again, got a shout out to our guy, Nico. Nico's been developing for like a decade, Katie, or something. And this is the largest code he's ever built. So you guys just didn't start small. You went right to the big thing. But again, you guys did a great job with implementing it and really putting the patient and your staff, the staff training first. And that's why it's so successful.
Yeah, and I think our executive director, our CIMO, Dr. Tannenbaum, they realized how important it was, how time-consuming this process was, that it was worth the investment. So it's great.
Absolutely.
Yeah.
Well, and it's, again, kudos to you guys, not only being the trendsetters and the spearheading it in St. Peter's, but also spearheading it in the state too, being the first organization in New Jersey to successfully automate something. You guys should be super, super proud of it. And I know FHI is also just very impressed with the work that you guys all did.
Absolutely. And Amatek should be proud as well. We all did this together. So it's fabulous.
No, it truly was a joy working with you all. I know sometimes you were
not getting rid of us so soon, Meg.
No, we're never getting rid of it. When we got on our call earlier this week, we were like, did you guys just miss us? I think you just missed us. We're so used to talking about every single day for a while.
I know.
No, we don't want to, and that's how the relationship's supposed to be, right? We're here to support throughout, and that's the difference. Is it's not a set it and forget it kind of, especially when you're talking about clinical stuff, right? It has to work. So, it's nice that we still can continue those conversations and making it better.
Yeah. And there'll always, in healthcare, there are always changes, there are always updates. And then there's always changes and updates with the PRA process as well, PRA Connect. So yeah, you can't get rid of us that quickly for sure.
No, that's okay. We're happy to keep you work together.
We're stuck with each other and we like it.
Exactly.
Well, Michelle, thank you so much. I know that it's a lot to share, and this process like the back of your hand now for sure. So appreciate you taking the time, and we truly, Katie, myself, will say, Nico, the whole team has just loved working with you all, and again, we're excited to continue the partnership, and we thank you for taking the time to share this. We hope that this eliminate some fears or some concerns of other people looking to automate some sort of clinical workflow, because again, Katie and I are like a broken record, but this is where we always are trying to really show people, illustrate that this is something that can work in your clinical operations and can truly help your staff.
It's so valuable for your staff, for your patients, accurate information, and it is challenging in the clinical area, but it's so needed.
Mm-hmm. Yeah. So Michelle, thank you. We appreciate it.
And I know we'll talk to you again next week.
Yeah, probably tomorrow. Thank you again for having me. I appreciate it. You guys have been so fabulous to work with, for the past year, and anyone else would be lucky to work with you guys. Really wonderful team.
Likewise.
Yeah.
Well, Laura Lee, I'm going to turn it over to you to maybe look at some of our poll information.
Sure. Thank you very much, Katie. And thank you to Michelle again from me too. I haven't had the pleasure of working with you as closely as Meg and Katie, but it's been great going through this process of preparing this webinar with you. So our responses to our poll were a little bit light, but as expected, clearly there are concerns about the amount of time that clinical staff are spending on paperwork. And so I actually wanted to follow that up with a question that I think many people might have, and that, we talked a lot, you all talked a lot about um, what went into this process and how much work and time was put into making sure that this automation ran correctly and is successful. But what is the ultimate benefit to your staff, Michelle, in terms of time savings? Like, what does that look like now for them compared to before the automation was in place?
So it does take time to enter the information in the EMR, of course, but they're already in the EMR. They're already documenting all the patient's information in the chart, so it's there and they can do it live. They don't have to go back and spend, minutes, hours, going back and looking through the chart and searching for this information. They put it in and they're done, and that's it. And it gets moved over by the bot into the state's website, so that's a huge time savings. It really is. And the way we built it is that it's not based on the visit, so even if they did want, the nurses or the medical assistants wanted to go back and add additional documentation in the chart, they could. So they can go right in there into the perinatal history. We built fields in the social history referral section, and they can just quickly add that information. And there's time between when the bot is actually submitting the PRA versus when the patient's seen.
And Michelle, one thing we didn't talk about was there was one area that was really struggling to complete the PRAs prior to the automation. And so now I believe they're at 100% submissions, which is dramatically different and good for all of the patients.
Yeah, absolutely. I think, they were short-staffed and they had trouble completing the manual documents, the paper and going onto the website, and just, this process has changed everything for them. And, they're definitely, they've made big strides, which is wonderful.
And on top of that, which we didn't really touch on, is with your three kind of branches of your women's health division, this has not only made the PRAs, happen consistently throughout that, but it's also made, Michelle, I don't want to speak for you, but it's made a lot more collaboration across your departments, and also a lot more consistency in how every area is charting too.
Yeah, and that's a really big thing, is making sure all the information is there in the same spot, no matter where you are, which department you are, we're all documenting in the same area. So, and making sure all the information is complete. We're not missing anything. And I think, as a team at St. Peter's, like, we're very supportive of each other. So if someone has a question in the birth center or high risk or women's health, we feel free to just reach out to each other, or with Wendy, who's been so supportive, and we're always bouncing things off each other as well. The communication is key, really, what it comes down
absolutely.
to.
So the next question is for Meg and Katie. In terms of what's needed to prepare an organization for an automation, what does that look like for a clinical setting compared to a non-clinical setting, in terms of what you need everyone to know? How do you go about preparing them for the process that happens before you even get to the automating of their workflow?
Yeah, I'll start and then Meg, jump in, please. Well, I think one thing that's the same, regardless of whether it's clinical or non-clinical, is having that reverse demonstration, where we said, in this case, Kai and another staff member showed us their current process, so we could march it out step by step and see where we could standardize and what we needed to do from an automation perspective. I think the thing that's most different, and this is again where Meg and I are a little bit of a broken record, is because Meg and I both come from the healthcare space, me being a former clinician and Meg being in operations previously. I think it was helpful to be able to speak the same language as Michelle and Kai, and to be able to ask clarifying questions that maybe a non-clinician or someone that hasn't been in healthcare operations in some way would not maybe understand, and help our developer to understand as well. I mean, one of the conversations I remember having that we laughed about the other day was about vacuum assisted births. And our developer was like, I didn't know that was a thing. There was a conversation about that and how to set up the automation for the different kinds of births that happen.
And just to add to that, Kate, I think really, and we touched on it a little bit, but knowing that there has to be some recommendations and process improvement first before you try to automate. Because if we would have tried to automate what Kai showed us, in the beginning, like it could be here, it could be there, it could be everywhere. We probably wouldn't have a bot that's functioning as well as it is right now. So I think going in with the expectation that this has to come first and this is going to take a little bit of time, but you're going to reap the benefit in the long run. So I think that when you're talking about clinical workflows, there's just a lot of hands in the pot. There's a lot of nursing staff and admin staff touching any sort of patient record. So there is a lot of standardization opportunities always. So you have to be willing to invest the time and have the patience. I think, we talked about the patience is the virtue there. And just be very, very mindful that you're dealing with patient health information. Like the amount of times, Michelle, I've got to call you out very specifically. We're so good about but we need this referral to go in as soon as possible because this could mean that they get resources now versus the next day. So making sure that we kind of always had the patience and, as the guiding light of what we were doing and not just automating, a technical workflow was really, really important.
I would also add, and Michelle, you can speak to this too. I think being able to do the chart audits after we went live provided everyone a little bit of security to know that there was someone that was double checking that A, the bot was working, but then also B, that the documentation was in the right place. So then I could email you, Michelle, and say, oh, you know what? This would have gotten missed by the bot had I not been checking. So just let's make sure that it gets documented here. I thought that was really good. And then you started to see the improvement over time. So you could start to go, okay, I trust the bot. This is good.
Yes, that was really huge for us. I don't know if we would be able to do it just without that process. That was really important for you to do that. It was really great. We learned a lot as well. Things that we didn't think we were missing, or maybe the bot was missing. We had to adjust logic, things like that. And, you can't expect everything or prepare for everything. So that was really a big part of the process.
All right. Well, if there are no further questions, we can wrap up. I would just like everyone to know that if you are interested in learning more about this process or how you can start your own automation journey, Katie, Meg, Michelle, and hopefully Kai will be at the Healthcare Intelligent Automation Summit at the Banner Health Desert Facility in October. I believe it's the 22nd and the 23rd. So if you're attending, please seek them out. I'm sure they would be more than glad to answer any of your questions and share their experience further. So thank you all for attending today. As I said, you will have a link to the recording of this session in your email soon. And we hope we see you again. Thank you all for all of your expertise today.
Thank you.
Thank you.